afternoon to each and every one of you. Welcome to the Cool Mom Super Dad Zoomina session on a very interesting topic today. So I welcome you all here. Selamat datang, salam sejahtera. And we have a participant from Thailand, Sawadee Krap. And I know we're supposed to have a participant from Japan, Mr. Zulkarnain. Unfortunately, this morning he had some medical challenges, so unfortunately he cannot join us today from Japan then. So we will still have our eminent speaker to join us. Welcome again, Dr. Adnan Omar. Thank you for joining us all the way from Johor Bahru, and all the other participants. Before we start the session, I'll just highlight to you some of the technical matters. Number one is appreciate if you do have a background to mute your mic so that we can focus. This is being recorded and is also live on Facebook to allow others who may not be able to attend this session. And I have put in the evaluation, survey, a pre-survey to enable you to provide us in terms of the level of understanding in this subject and what are some of the questions which I will be posting to Dr. Adnan as we go along. And in addition, we will also be able to try and invite some of you for any of your inquiries through the chat and be able to highlight to us any clarification. So as far as the format is concerned, I'm Ahmad Fakri, your moderator, and our main speaker is Dr. Adnan Omar. Selamat datang, Doctor. And I know it has been challenging for him because he has been juggling with so many inquiry and requests. And in terms of this subject matter, being an expert, a psychologist, as well as someone, for the first time I heard the word suicidologist, which is an interesting position to hold. And of course, I have my other better half, Puan Jamila Samian, who will be a moderator but also be engaging with Dr. Adnan in terms of some of the questionnaire and insight that we have received from some of the parents as well as youngsters who have indicated their thoughts. Now, we are in an interesting time during the pandemic. Now, a couple of weeks ago, the number of suicidal cases for Malaysia reaching at 266 is almost the same number with the COVID death. So some people died because of the virus, while others died because they think that that's how they want to end their problems of misery. Globally, ladies and gentlemen, every 40 seconds, there is a death of someone commit suicide. 40 seconds, according to the world record, which at the moment about 800,000 people per year. And there is a day called World Suicide Prevention Day, in September, 10th of September. So again, it is a worrying trend, especially here in Malaysia, that 2016 data shows that there is an increase of 10% of suicide case amongst the youngsters at the age of 13 to 17 years old. So again, this is something very alarming. And although Malaysia sits at the ranking of 128 out of 183, which is about the bottom 30 percentile, but the fact that the number is increasing is a worrying trend amongst the community as well as parents. I'd like to welcome Brother Zul, who's apparently now joined us, and I give him the liberty to join because of his condition, but he will be able to comment if he decides so after the session. Japan at the moment ranked number 30 out of those countries So he's in the top 30. Korea is number 10. So you could see now that it is happening around the world. So without much ado, the format is, Dr. Adnan, I allowed you to then give us a basic understanding, because based on the feedback that has been given, majority have no clue or very little awareness on the subject matter. So maybe then you could enlighten us with some basic found in information, and as we go along, we could then ask more about the symptoms and then the how to help those at the initial stage then. So again and again, this is a topic which requires lot more attention now, although statistically for every one case there is a 10 potential case, and just within half a year already close to 500 people has attempted to commit suicide then. So Dr. Adnan, maybe you can also enlighten us a bit more of your background and dive to the subject. Over to you then, Dr. Adnan.
Thank you, Jeff Fakri. Okay, Assalamualaikum and good afternoon, and salam sejahtera semua. Yeah. First of all, thank you for having me today. Thank you to Encik Fakri dan Puan Jamilah. Actually, we met a while ago because of our kids. Both our kids were studying in the United States, and that's where we actually met. Okay. My name is Adnan bin Omar. I am originally from Kelantan. I got interested in the topic of suicidology when I was teaching at one of the colleges under MARA many years back. That college had ADP program, American Degree Program. My wife and I were teaching there, and there was one case of student who was thinking about suicide. And for whatever reasons, that case was given to me. And apparently back then I didn't know there's a mental illness called schizophrenia. Now that I know, okay, so he was having schizophrenia that led to his thinking about suicide. That was my initial interest in suicide. My background originally for my undergraduate degree, first degree, I did international relations and sociology, even though my high school background was all in mechanical engineering. I completed a switch, even though I later on did marry a chemical engineer. Okay. So I went to the States basically to pursue my postgraduate in suicidology, attach myself to the Center for the Studies of Suicide, okay, at South Carolina University. Okay, since then I pretty much engaged myself in the topic of suicidology. Okay, so that's pretty much what my background is. I was in the States about 14 years. Then when I came back, I was the director of Psychological and Counseling Services Center at Taylor's University. Then I became the Dean of Student Affairs at Berjaya University College in Bukit Bintang. Okay. Before I joined a private primary and secondary school institution in Johor Bahru, where I am based right now.
Okay.
I also belong to two NGOs. The first one is Psycho-Spiritual Ikram, that basically provide services to anybody who have social and mental issues. I also belong to Persatuan Kesejahteraan Psycho-Spiritual Malaysia. We provide free services to all Malaysians who need some kind of counseling services. So we have a hotline that they can call in. We also have registered counselors if the clients wish to meet face-to-face. That's pretty much what I do. And I also conduct a lot of sessions with school counselors and university counselors and students on motivation, depression. And last week I was on SPM, Selamat Pagi Malaysia, with TV1, talking about depression and the pandemic. Okay? That's the best background.
Thank you, Dr. Adnan. can you share with us the symptoms for depression and suicide, right?
Okay.
Suicidal thoughts. Are they similar? That's the first question. My second question is, we know that there are cases where people are depressed and having suicidal thoughts, and yet they function just like anybody else. And I believe this is even more tricky for family members, because when we think about any illness, we have some idea that the person is not well because of the symptoms. And yet there are people having suicidal thoughts, experiencing depression, but on the outside, it appears that they are totally all right. So how do you deal with these two cases?
Okay. Number one, we are using the guideline given by WHO on the symptoms of suicide. Okay? There are about 8 or 9 symptoms of depression. And then we're going to talk about the link between depression and suicide and the debate around it, of course. Okay. So the first symptom of depression is feeling depressed most of the day. Okay. First, what we do as clinical psychologists and psychiatrists is that, okay, all these 8 or 9 symptoms, you must have them more or less minimum for 2 weeks time. Okay. And the assumption is that, okay, if you have 5 out of 8 or 9, medically speaking, you are having major depressive episode. Okay. Medically speaking, if you have 5 out of 9 within 2 weeks, then it requires a professional medical intervention. Okay. So the first one is a depressed mood most of the day. Okay. What that means is that you feel very empty inside most of the day, and sometimes you feel like you want to cry. Okay, out of no reason. That's the first one. Second one is when you begin to lose pleasure in the things that you used to like. Okay, let's say that if your own kids, they love to play futsal or football, and suddenly they don't want to play futsal anymore. Okay, or they love to go shopping on the weekend, and suddenly they want to go shopping anymore. Okay. Number 3 is regarding your appetite. Humans are very interesting. Okay, some people when they're depressed, they eat more, and some people when they're depressed, they eat less. So the guidelines that we are using is that plus minus 5% of your regular body weight. So it is too much to lose 5% in 2 weeks, or too much to gain in 2 weeks' time. So if you want to make a joke, actually, the depression is a very good way of losing weight. Next one is extreme fatigue or loss of energy. Okay, for normal people, when we wake up in the morning, we are full of energy. And when we reach the noon time, we may feel tired. As we approach evening, then we tend to lose some of the energy. People who are depressed, when they wake up, they already feel very, very tired. Next one is sleep issues. Okay, there are 2 of them. Either you are suffering from insomnia or hypersomnia. Insomnia is lack of sleep. Hypersomnia is you don't want to wake up at all. Okay, so the normal range is between 5 to 7 hours of sleep per day. So insomnia means somebody who is depressed can go without sleep for 24 to 48 hours, or they have slept for about 12 to 16 hours, they still don't want to wake up. Those are clear symptoms that somebody is depressed. Okay? Next one is psychomotor agitation or feeling restlessness. You sit down, you don't feel okay, you wake, you get up and walk. You get up and walk, you don't still feel okay, you want to lie down. You lie down, you still feel restless and you want to get up. Okay, there's nothing that you do, you feel okay. Okay? Next one is feeling of worthlessness or excessive guilt, okay? Especially for something that you have done in the past or something that you think you have not done in the past. And then you begin talking to yourself, I'm no good, nobody cares about me. If I go, if I die, nobody cries, and those kind of mental monologue that you have yourself. Next one is reduced ability to think and concentrate. Okay, you go to work, okay, and you want to concentrate at work, your mind goes off. You go home, you want to focus at home, your mind goes off. Okay, and then if you have 5 of those, the one that I have mentioned, and if it's not dealt with, it can lead to the number 9, which is the recurring thoughts of suicide. Okay, those are the symptoms that clinical psychologists or psychiatrists use to measure depressive symptoms. And they use 5 out of 9, and it must last about more or less 2 weeks time.
Yeah.
Okay?
Right.
Yeah, thanks very much, Doc. Those are the symptoms, but if you trace back, they are also what we call the pressure points. So when I was looking a case, the situation in Japan in 20, they came up with about 7 reasons why this depression happened. And 49%, which is half of the reason cases there, is because of health issue, which is both mental or physical. Second one is financial, poverty. Third one is the relationship because of family disagreement. The fourth is workplace. And then there is also the issue about personal heartbreak, schools, and others. So when you look at our situation, for instance, in Malaysia or Asia in particular, what has been the cause predominantly that lead from depression that ended up with suicidal thoughts?
There is a multi-million-dollar questions. People have been doing research on these issues, talking about the cause of suicide. Okay. From the medical point of view, it is believed that depression leads to suicide.
Okay.
Okay. That's purely from medical perspective. Okay. It has some controversy because not all psychologists believe in that link of causality between depression and suicide. Okay, I am one of those who believe that because humans are very complicated beings, there's no single issue that leads to a single defense.
Okay.
So for the last 15 years or so, we began to look at multi-dimensional approach of explaining any human behavior that we call bio-psycho-social explanations. Okay. So let's probably sit back and use a simple example. Okay, why do humans eat? For example, okay, there is biological explanations, there are psychological explanations, and there are social explanations. Why do we eat? So I'm going to ask Puan Jamila, why do you eat?
I'm hungry.
Hungry? Okay. Chef Fakri, why do you eat?
I desire to have that nasi lemak.
All right.
And then later I want some tom yum in the evening. So there is that feeling of wanting to eat some of your special food then.
All right. So,
by the way, I also enjoyed having my friends, a good company.
Exactly. Okay. So yes, there are biological reasons why we eat. Biological reasons mean we eat because without eating we will die, because that's biological needs to eat. But okay, there are some psychological reasons why we eat. Okay, like Chef Fakri said, he enjoys companies of others while eating. Okay.
Yeah.
But there are some social reasons why we eat. Because if we eat only because we are hungry, then we might get trouble during Raya seasons, isn't it? Okay. Because after 2 houses, we all biologically full, but we still have to eat because there are social customs that we have to kind of respect that we still need to eat. Okay. Take another example. Why do we get married? There are biological reasons, there are psychological reasons, and there are social reasons. Puan Jamila, why did you get married to Encik Fakri? Or to any other man? Forget Encik Fakri.
Well, I feel that I needed a partner.
Right.
And I've got my blind spots.
All right.
By getting married to somebody, making a lifelong commitment, I can become a better person, and so will he. And
Yeah.
we can reach certain goals and objectives that I
Exactly.
wouldn't have achieved if I didn't marry.
Okay, that is a psychological reasons why people get married, because they want to go home and feel comfortable, and that kind of. There are biological reasons why people get married, because they want to have kids and they want to pass on their genes, and of course there are social reasons why we get married, because if you don't get married, you go home during Raya, and mom and dad will begin asking you, why aren't you married yet? Okay, so a similar thing when we look at suicide. Okay, yes, depression is a necessary condition, but it may not be a sufficient conditions, because depression looks solely from the perspective of biological reasons why people commit suicide. Okay, the one that H.F. Fakri highlighted about those 6 or 7, right? Those are psychological as well as social reasons why people commit suicide. Okay, so to fully understand this human behavior, then we should look at all these 3 components that explain any human behavior. Okay, from medical perspective, of course, they rely on biological explanations. Then most psychologists would look at the psychological reasons, such as hopelessness, helplessness, for example, the thinking patterns and those kind of things. Okay, and of course there are social factors, the lack of support group, family reasons, and so on and so forth. And there is a very well-known psychologist by the name of Edwin Schneidman. I had a privilege meeting him. He had a clinic in California, actually. Okay, and he treated only suicidal patients. And looking at all of the clients that he had in the whole career, he said, okay, for that tipping point and that Fakri was telling, okay, he said, yes, depression is one of them, but according to him, that tipping point is hopelessness and helplessness. Hopelessness means tomorrow will never get better, no hope. Okay, helplessness means not only that tomorrow will never get better, nobody cares. When you have that explosive combination, then you will commit suicide, because you think that tomorrow will never get better, but then nobody will come and help. Okay, so the argument is some human beings, all of us, once in a while do feel hopeless about something. But if somebody comes in our life and say, I do care, maybe that hopelessness will tend to reduce. That's why from social perspective, from counseling perspective, having a support group is a very critical issue, okay, in assisting suicidal person. Support group means family members or colleagues at work who understand you, or friends. Okay, so it's a mixture of a lot of things, okay, that may push you towards suicide, or may pull you away from suicide. Okay, then when we break down by age, by race, okay, all those explanations become varied, meaning there is no single definition that leads to suicide. Depression is a leading cause of suicide that is from medical perspective.
Yeah,
right?
thank you, Dr. Adnan. Yeah, I have a question about, you know, when we talk about creating that positive as well as supportive environment for our children, not necessarily our biological children. It could be in the educational sector, where the children and youth could be your students and whatnot, could be your nieces, nephews, or even your neighbors' children. Now, how do we know that we are doing the right thing? Because there might, I mean, on the one hand, we as parents and educators, in trying to create that positive as well as nurturing environment, we also don't want to swing to the other side where we become so accommodating, as well as, you know, the danger of mollycoddling. So this is one of the concerns of parents and educators these days. How much of a space do we create for our children? Because we don't want to go to extremes, not providing that needed support to the children, as well as on the other hand, you know, we provide so much support that they are not able to grow up as resilient and tough people who can survive anywhere they end up.
Okay. Okay, this is a module on parenting. Okay. Okay, I believe that life requires balance. That's the key word about leading a very healthy life in every aspect. Okay, in biology we learn about equilibrium. Okay, if you look the way the body is created, you have two legs, two eyes, two ears, even the brain has left and right, so that we may not become sengit human beings. That's equal. Okay, if you draw the lessons from them from one of the sayings of Prophet Muhammad SAW is that makanlah kamu, eat but stop before you feel full. Makanlah kamu dan berhentilah sebelum kenyang. Even eating requires some kind of balance, because that's how life is supposed to be. Okay, so when come to interacting with kids, I believe it's the same principle. Okay, it's a very, very, very difficult balance to do. Okay, it's like playing a kite. Okay, sometimes you have to let it go, fly free, but at the same time you have to pull back, because if you keep letting it free, it's going to be lost. Okay, but you have to gently pull it back so that your child knows where the point of reference is when they have issues with you. Okay, so that's pretty much the basic issue about raising kids, balancing. Number two is open communication. This is where I think a lot of us are struggling these days, because maybe of the work demand. Okay, during the pandemic, a lot of parents begin to complain now because they have kids 24 hours with them, and suddenly they don't know what to talk to their kids, how to talk to their kids, because they have not had this so-called family relationships before. Because before, the kids went to school, they came home, and by the time they come home, then they engage in routines like eating and taking bath at night, and then they go to sleep, and the whole routines begin again. Okay, so now they have this huge opportunity to truly talk to your kids. So open communication means invite your kids to talk, okay, and then do not prejudge that much but what they say. And number three, be aware of this thing. Okay, because I always believe that a lot of parents nowadays resort to a third party to communicate to their kids. That third party turns out to be this thing.
Handphone.
Okay? Handphone. It's a phone, basically. Okay, and I think we begin to have problems, because if we use phone to communicate, I do not think that the emotional part gets through our kids. Okay, so I always advise parents, for example, when you go pick up your kids after school, do not ask your kids the same question that you have asked them. For example, on Monday you ask, how's the school today? And then Tuesday you ask the same thing. Sometimes even before you finish asking, they already answer, it's okay. So you pick your school on Monday, ask your kid, okay, this morning mama gave you 10 ringgit. What happened? Is there any balance? Because you want to know the financial management of your kids. Okay, on Tuesday when you pick up your kids, ask your kid, well, during lunch today, with whom did you have your lunch? Because you want to know who their friends are. On Wednesday when you pick up your kids, okay, you ask your kids about, well, how's the math teacher today? How's the Bahasa Inggris teacher today? Because you want to know your kids' perspective about their teachers. And those are all open communication. And when they say something about all those issues, well, just think, don't respond much. Encourage them to talk more and more and more. I think the challenge with modern parents is maybe we are emotionally not rich. Therefore, we cannot share that with our kids, because we ourselves may have issues.
Yeah. I think in tandem to Puan Jamila's question, and also there is a question in the survey that pointed out that when you say asking questions, there is an element of expectation which will potentially create stress. Stress to the receiver or even the sender who has an expectation. Now, before depression, before suicidal, is stress an element that pushes them into moving from this emotional feeling state to another state and the next state? Because I suppose when you are depressed, is already some prerequisites has to happen, as you said, sleeping, but those have some other causes. So how do you comment about stress issues and expectation issues that is probably one of the reason why could be children, it could be adults facing this depression and leading to suicidal thoughts?
Okay. If we look at 2017 survey, the survey was done by the Ministry of Health, actually, for all our school kids from Form 1 to Form 5. Talking about 13-year-old until 17-year-old, on their mental health and so many other issues, actually. And talking about suicide, they measure 3 things about suicide: suicidal ideation, meaning thinking about suicide; suicidal plan; and suicidal attempt. So the survey was done in 2017. There were about 2 million plus high school students, secondary school students surveyed in Malaysia during that particular year. And the depression rate was 18.3%. 18.3% of our secondary school students, Form 1 to Form 5, were having depression. Compare that to the national depression rate, which is only 2.3%, meaning the whole country, the whole population is only about 2.3%. But from that cohort of kids is 18.3%. And 10% of them are thinking about suicide. 7.2%, 7.3% have planned about how to commit suicide, and about 6.9% have attempted suicide, basically.
Dr. Adnan, I have a question. I understand that there are risk factors,
right,
that might cause or motivate a person to, especially children, to think of suicidal thoughts and feeling depressed. But what is puzzling these days is that there are children, and especially teenagers, who are raised in stable homes, and for some reason, we are talking about good families, stable families, nurturing families, but they still experience depression as well as suicidal thoughts. So for parents, these come as a shock, and of course they always ask themselves, they always ask themselves, what have I done wrong? What could I have done differently? So can you please comment on that?
Okay. Usually I share 10 myths of suicide, 10 false beliefs about suicide and depression. One of the myths is that suicide happens without warning. Depression happens without warning, which is a myth. Because when it comes to social life, nothing happens without warning. Nothing happens suddenly. Nothing happens out of context. Nobody wakes up one day and suddenly becomes fat. It doesn't happen that way. Okay. Nobody wakes up one day and feeling depressed or feeling suicidal. Nobody wakes up one day and become the Prime Minister of Malaysia. Nothing, no social life happens that way. Okay. So we're going to look at, I'm going to present 2 cases today. Maybe we do this case and then we understand better. I think many of you are aware about the case that happened in Sarawak before. Okay, the case of Davia Emilia, 16 years old, basically. I'm going to read to you the newspaper article written by Bernama. Okay. Kuching, the 16-year-old girl in Sarawak who committed suicide on Tuesday after holding a poll on her Instagram, believed to have been battling depression. Palawan District Police Deputy Chief DSP Mervin Lisa said, based on the investigation, the girl who was known as Davia Amelia, 16, was suspected of experiencing depression. However, based on the statement from victim's mother, she did not show any behavioral change prior to the incidents. According to her mother, who claimed did not see any behavioral changes, according to the mother, the victim was close to her stepfather, but since the stepfather married a Vietnamese woman, he rarely returned to Kuching to meet the victim. It caused the victim to feel sad. As for the mother, she is an Indonesian who remarried for a man with a 15-year-old son. So this is the thing. We think there's nothing going on, but there's of course something going on. And if we look at the Facebook of Davia Amelia, okay, she posted that poll on Instagram. Okay, it was horrific. It was horrific because she posted, "Should I live or should I die?" She was requesting the netizens to vote. Okay, when the vote became "I should die" over 69%, and she committed suicide right there online, basically. Okay, but she has communicated her intention of suicide months before that on Facebook, actually. Okay, but friends, maybe, and family members either failed to see that or did not take it seriously. Another case that I'm very familiar with is the case of Sally. Okay, Sally is a 17-year-old science stream student from SMKI Leleh Melaka. This case was 2011. This case hit the news ever that happens on a school ground during the school hours. Okay, back then, Kementerian Pendidikan Malaysia did not have any SOP or protocol how to respond if a suicide happens at school. Okay, so she, on that particular Tuesday, before to school, she already left a suicide note on her Facebook. The suicide note read, "This is going to be my last Chinese New Year. Please bring a teddy bear and a coffin for me." And she has mentioned about that months before she committed suicide. The main reason why she felt that way, because the relationship breakup with another male student at the same school, basically. Okay, so from suicide studies, yes, kids seem to be okay. Okay, but I think we need to do a better job in looking for symptoms. Okay, providing them an open space to communicate those negative feelings that they may have. Okay, otherwise they will turn to, these days, online and maybe seek help that way. But unfortunately, people online either do not understand or do not care. And of course, in the case of Davia Amelia, a lot of those kids simply tell her, "Well, I dare you to do so if you think that you are serious," unfortunately. Yeah, so that what happens. So from the perspective of depression and suicide, nothing happens that way, because actually the major predictor of completed suicide is indeed suicide attempts. Okay, meaning that humans have an enormous ability to be consistent in life. What that means is that, okay, we, over the years of our life, we develop routines, we develop consistency, positively or negatively. Okay, for example, if somebody gets stressed and then resort to, let's say, drugs and alcohol, okay, and then the next month when the person is facing similar life issues, the person might resort to drugs and alcohol. There's a consistency there in patterns of coping mechanisms, basically. So as parents, okay, we need to look at those patterns of behaviors that our kids have shown. And I strongly advise all parents these days okay, please go through the postings and the chats that your kids post online. Maybe they will not tell you verbally. You might want to engage online, just like the case of Davia, Amelia, and Sally. Both of them have talked about it for many months, and they have left their suicide notes online, but the parents were not aware about those things.
Mm. Yeah, I think this, we are dealing with kids now who express themselves outside. But before they express outside, and there is a question that sent privately now, anonymously, is that there are some thoughts that been hearing in their mind. Yeah, so these are thoughts, as you said, ideation just now, and then before leading to plan and attempt. This ideation is the first initial stage. Yeah, and sometimes talking to your own close family members can be more detrimental, solving the problem, because they just either brush it out or just sort of make it worse. So the first point of cut now is in your mind, the state of your mind, thinking of this, feeling upset, stress, and that sort of thing. So how do you, is there a way to fix this internally in the mind, so that then you could switch off? And one of the possible way that this questioner is saying that talking to a stranger.
Okay, very good. Okay, I am, from psychotherapy perspective, I am a CBT guy. Okay, cognitive behavior therapist. Okay, pretty much focusing on how do we change the mind of a person, okay, to deal with the life issues, basically. Okay, and then if you look at the reference that I gave before about Edwin Schneidman's study, based on the clinic that he had in Los Angeles, he came up with 10 commonalities of suicide, focusing solely on what goes through the mind of a suicidal person before suicide takes place. Okay. Okay. So the whole point is that what makes us human, for better or for worse, okay, what makes us great as human beings is our ability to think, our ability to imagine things that is not that. Okay, mean that I can imagine, if I were to live up to 80 years old, I could imagine what I would do when I get there, even though I am not there yet. That's the thing about human beings, the cognitive ability. Okay, so I strongly believe that if we can tweak and play around with the way people think, okay, and therefore we can help them in reducing their suicidal. True, everything begins with an idea. Nobody sits next to the refrigerator and asking, why am I standing right there here? Maybe they were sitting in the living room and the mind says, well, I'm thirsty, I'm hungry. So therefore they walk to the fridge and open the fridge and looking for something to drink or eat. That's what human is. If you're walking to a store tonight and you see a lembaga or whatever, a monster-like thing, okay, and automatically you have to decide what that is. Okay, if you think that it's a ghost, then you feel afraid, and then that would push your responses of your legs and your whatever. Okay, so it's all with your mind. One of my KPIs in life is to see a ghost, because I don't believe ghosts exist. If I were to go to a store tonight, okay, and see something like that, instead of running away, I would approach it, because, oh, thanks God, one of my KPIs has been achieved. Then I would approach it and I might ask, well, which planet are you from? Do you have Facebook or whatever? Instead of running away, I would approach that thing, because that's the way I think about that thing. Okay, similarly, so according to Schneidman, okay, one of the things that we have to understand about the way a suicidal person thinks is that, number one, okay, that thing about hopelessness and helplessness. Okay? Number two is called construction. Construction means, yeah, humans are very resourceful. When we have problems, we do try to the best of our abilities to solve it. Okay? The same thing with suicidal people. They have tried, they have tried, they have tried, they have tried until they ran out of resources. By then, okay, their thinking become narrower and narrower and narrower. At the end of the day, they begin thinking like black and white. They begin thinking about either or. Okay, in the case of Sally, either I get that guy or I die. Either I get all A's for my XPM or I don't get anything. Either I go to Harvard University or that's the way they think. Okay, healthy people see life as a continuum of things. Okay, if I don't marry Fakri, it's okay. I have Najib and Muhyiddin to choose from, for example. Okay, so it's not either Fakri or nothing. Okay, so that's the difference there. So meaning when your kids come to you and begin using the language of either or, either black or white, either day or night. Okay, that is one of the symptoms that their thinking has become narrow.
Constricted, yeah, narrow.
In that sense. Okay, those are the things that we probably want to look at the mind of suicidal person. Okay? That's what we intervene right away with changing that thinking.
Okay, so you see, the thing is that in our society, at least in Malaysia, the impression that I get is that there is a stigma when it comes to mental illnesses and having depression, experiencing depression as well as suicidal thoughts is something that is very unpleasant, I would say, for most parents to hear from their children, or even for parents themselves to experience. And it's not like you're having a cut or a wound, you can just go to the doctor. And there is such great reluctance to even seek help. For some parents or even educators, either they belittle what the comments or reports from children, or they go into denial for parents. So what would you say to that? How can we overcome this?
Okay, this requires multi-level cooperations to reduce the stigma of anything, especially when it comes to mental illness. Okay? Number one, I guess, at the government level, okay, they have to launch more campaigns and awareness. But I always believe, because I am an academician, I am an educator, I always believe that individuals can have better choices in life if they have proper knowledge about life. And people are always afraid of something that is unknown. I think that's what the Malays are afraid of ghosts, because that's something that they're not known. Okay, so if we can get a syllabus, a subject about mental health, starting from secondary school, and teach our kids that way. Therefore, they know exactly what mental health is. They know exactly what depression is. Okay, with proper factual information, they can better guide themselves that way. Okay, next, at the family level. Okay, we live in the 21st century. Okay, and when it comes to knowledge, is everywhere. Okay, online basically. Okay, you go to WHO website. There are plenty of discussions about all these issues, basically. Okay, so get proper information. Next one is reach out. Now there are a lot of NGOs in Malaysia who are more than willing to intervene. And then mental health is not that uncommon. 4.2% of the Malaysians are having some kind of mental health. Actually, that is about 500,000 of us. Okay? Okay, and depression is the most common mental health, because and number two is schizophrenia. Schizophrenia means the Malays always say that nampak hantu, seeing something that people don't see, or hearing the voice that people don't hear. That is the second most common actually mental health issues in Malaysia. Not just in Malaysia, because it is also common in so many other societies around the world. So in a nutshell, we need a multi-level approach to reduce the stigma of depression, mental health, and suicide in our society.
So let me try to tackle back that question when you say about their mind, though, helplessness, hopelessness, and all those things. Now, we are in the stage either can do it proactively or reactively. And one of the way you have suggested when Jamila asked was getting help from outside. But maybe there are some coping strategy and coping techniques that individual can do irrespective of their religious belief as a universal human being that they could at least minimize before reaching out to others. And I think that may be some of the coping strategies and approaches that you could do before you reach out. Maybe you have some kind of a formula then, Doc. Help us to, try to do, I disagree that to do self, do it yourself, suicidal depression. Right. But maybe I'm just asking you probably some good tips to address that.
Okay, so far we are talking about the external parties helping suicidal individuals. Okay? Look for the symptoms and everything. So your question is, if I am suicidal, okay, what can I do for myself? Okay. Well, number one, it's okay to feel suicidal. It's okay to think about suicide. Because if we go to any society, about 10% of any society does think about suicide every day. It's a common thing. Meaning, if we go to, let's say, Sunway Pyramid, we stand at the entrance of it, and then let's say that as 100 people walk in, we ask 100 people, are you thinking about suicide today? 10 out of those 100 will answer, yes. Okay, you do the same thing in America, you do the same thing in UK, you do the same thing in Singapore. Pretty much, according to most research that we know, about 10% of any society does think about suicide, meaning that they're thinking about it. Okay, so it's okay to think about it. Okay? Yeah, it's just not okay to begin doing something about it. That's number one. Okay, number two, listen to your body. Okay? Listen to your body means our body is the strongest machine that's ever created. Okay? Even though we want to think that Superman or Batman or Iron Man, all those robots are much more impressive than human beings, but all those men and robots are the ideas of human beings, basically. Okay? So basically, when we are not well, okay, our body will send a signal, because our body will try to correct things when it goes out of equilibrium, because it was invented that way. Okay, when I get stressed, okay, the first thing that I get is the ulcers in my mouth. Okay, those are the white things that get into your mouth, and now eating spicy food will become not nice anymore. So my body is sending a signal, slow down, you are under stress. Okay, so that's why when I have ulcers in my mouth, eventually if I ask me, can you do a talk next week? I'm gonna ask no. Okay, I'm gonna put a break on my life. I'm gonna go jogging. I'm gonna go writing my books. I want to do something for myself. Okay, if you haven't had migraine before, suddenly you have migraine. Okay, your body is sending a message that you are not well. Take time for yourself. If you did not have diarrhea before, suddenly you have diarrhea. Okay, there's no food poisoning involved. Therefore, your body is going through stress, and so that's number two. Listen to your body. Okay, because there are some physical symptoms that when we are not mentally well, it comes out that way. Okay, number three, it's okay to feel pain and live life. Okay, I always tell people, you know, life doesn't have to be 100% every single day. Okay, and nobody, I guess not too many of us have 100% every single day. Now, it's okay to have cancer and live life. It's okay to think about suicide and live life. It's okay to quarrel with your mom and live life. Okay, so it's okay not to be 100% every day. So lower your expectation some days when things get tough. Okay, number 4, according to CBT, ask yourself, will I still feel this way 2 months from now? Will I still feel this way 6 months from now? Will I still feel this way a year from now? Because most likely you don't. When people say time heals all wounds, actually that's a very accurate phrase. Okay, you have a relationship breakup now, you feel so bad about it. Okay, will I still feel the same thing about 3 months from now, 4 months from now? Most likely, yeah. Maybe you meet somebody else along the way, you know, maybe 4 months from now you look at yourself, well, I was so stupid 4 months ago. How did I fall with that guy? You know, and those kind of things. Okay, so those are the things that will probably change the way you think about your existing challenge that might lead to suicide.
Yeah.
Okay?
I think you have outlined 4 of these coping mechanism using the CBT, cognitive behavior therapy, right?
Yes.
There is an inquiry whether is there such thing as self-therapy before you seek other approach or methods of therapy in this situation, doctor?
Okay. Self-therapy, there is physical therapy, there are emotional therapy, there is mental therapy. Okay, what I just suggested is probably what falls under mental therapy. Okay, because the assumption of CBT is if you think positive, you feel positive, then you act positive. That's the logic behind it. Because as I said, what makes us human is the ability to think, our intellectual ability.
All right.
Okay. So the lesson about life is, as much as you can, think positive. There are 3 ways of thinking, even though most people think there are only 2 ways of thinking. There are 3 ways of thinking: positive, negative, and neutral. As much as you can, okay, try to think positive. If you cannot, think neutral. Okay, I'm going to give you an example. I'm sitting in a room. Let's say somebody opens the door, and then that person begins cursing me for 1 whole hour using all the bad words that that person can find, the entire Webster's dictionary. At the end of 1 hour, I have 3 choices how to respond: positive, negative, and neutral. Most likely, I would respond positively. I'm going to look at that person. I'm going to say, are you done yet? All the things that you have said has nothing to do with me. Therefore, I can carry on with my life because I think positive, then I feel positive, I can carry on with my life. Okay? Responding negative means, well, he said 1 word, I'm going to say another word. He says 1 bad word, I'm going to say another bad word. Bodoh, lawan bodoh, super bodoh. That's what I mean, okay? So negative leads to negative thinking. Therefore, the whole day you are thinking about it. Therefore, you cannot function anymore. If you cannot be positive, then try neutral way of thinking. Okay, meaning as the person is going on and on and on telling bad things about you, you just ignore that person. Take your mind, goes to Hawaii and be okay with it. Okay, so that's neutral. Okay, another example, you go home for Raya and your mother-in-law who doesn't like you when you got married, you know, to his son 30 years ago begin blah, 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 blah. Okay, you have 3 ways to respond: positive, negative, neutral. Okay, responding positive is, well, this is not just this time. Every time I comes back for Raya, she does the same thing and just say, oh, that's my mother-in-law. Okay. So, okay, negative means, oh my God, I have not put my bags yet in the room. She already started all this thing. I'm going to have a horrible Raya. You already set up your mind that you're going to have a horrible Raya because you are thinking that way. Okay, or neutrally means, well, it's okay, she can go on and on and on. I'm going to enjoy my ride. Yeah, I'm going to connect with somebody else in the family, and I can just deal with her on that level. So that's neutral. Okay, that way I think you have this mental therapy, you live your life positively, and that should become a protective factor against suicide. Okay, okay, the last technique, even though we don't recommend this for you to do with yourself, because I do this with my clients, for me to properly assess the severity of suicide. Okay? I always use the scale of 0 to 10. 0 means, okay, I'm not going to kill myself at all. 10 means, yes, I will. Okay, when I'm doing psychotherapy with a suicidal patients, I'm going to ask that questions. Okay, so today on the scale of 0 to 10, where are you? Okay, so if the person answers one or two, most likely the person is just thinking about suicide. The person is not going to act on it. Okay, if the person says no, 7, 8 or higher, the next question I'm going to ask is not why. I'm going to ask, have you thought about how to do it? Because if the person has a clear outline, okay, tonight at 9 p.m. I have ropes in my bedrooms. Okay, they would better take it seriously. Okay, do not engage in the questions of why. You have to kind of thought of how. So maybe you can ask your the same question for self-therapy. Okay, today, where am I on this particular scale? Okay, if you answer to yourself, well, I'm 6 or higher, please go and see a professional right away. Okay, because you need to reach out, because you may not be able to control your thought before it becomes an action. Okay?
Yeah, I think there was one follow-up question to your suggestion on the coping mechanism number 2, which is listen to your body.
Yes.
Now, if your body has already an ideation or already a plan, like the rope in the bedroom kind of things,
Right.
Is that still worth a method, or this is the time that you need to now reach out? Because,
right.
yeah.
As a psychiatrist or as a counselor, that's where we usually, that's one of the ethical issues where we can break confidentiality. Okay, it's life and death issues. Okay, for example, during a session, let's say that a client confessed to you that, okay, tonight at 9 p.m., okay, I'm going to shoot myself, and the gun is in the closet in my mom's bedroom. Okay. Okay, by law, you are allowed to call the mom and inform on that issue, basically, because an idea has translated into action. Okay, so it requires a third-party intervention if you get to that stage. Okay.
Okay, talking about third-party intervention, Dr. Adnan, how does, I mean, for a parent, right, or even an educator, a teacher, where should they go to? To whom should they share this situation?
Okay.
If a child under their care reports having depressive or suicidal thoughts.
Okay. If you have knowledge about depression, the symptoms that we have talked about before, you can begin talking with the person. Okay, and in your mind, you can begin checking 1, 2, 3, or whatever. Okay, to assess, is it a mild depression? Is it a moderate depression or severe depression? Okay, but if you do not have such expertise and capability, I strongly advise you to refer the person to a professional. A professional means not just any psychologist. It should be a clinical psychologist, because depression is a clinical medical condition. Okay, and or a psychiatrist. Okay, where do we find them? Okay, the first resource is probably at the government hospitals. Okay? Many major government hospitals in every state does provide such services. Okay, I'm going to give an example of hospital Tampoy in Johor Bahru. Okay, it is the hospital that specializes just for this kind of issues. You can just walk in, basically. Okay, and they have the adult sections and they have children's sections. Okay, and another one that is great is PPUM in Petaling, Penjaya. Okay, but I'm very sure that all government hospitals provide such services. Okay, if you don't want to go to the hospitals, you can always go to your family doctor first. Okay, we call it the GP, general practitioners, and you can talk to your general practitioners, your family doctor, about your symptoms, and most likely your family doctor will write a reference letter for you to go to see a psychiatrist, basically. Okay, there are two paths of treatment options. Okay, number one is medication. Number two is psychotherapy. Psychotherapy refers to counseling. Okay, depending on the assessment of the professional, okay, whether they want to prescribe one medication, or they want to try psychotherapy first, or they want to begin with both, depending on the severity of depression diagnosis. Okay, so the difference between psychologists, psychologists and psychiatrists there is, okay, psychiatrists, they can prescribe medication, meaning in a layman term, they prescribe anti-depression medication. Okay, psychologists do not have such qualification to prescribe medication. If we want to go into details, what does medication do? Okay, the logic is like this. Okay. In our brain, there are so many juices. There are so many liquids. Okay, the happy juice is called serotonin. Okay, the logic is, as your depression goes up, your serotonin goes down, your suicidal thought goes up. Okay, that's the logic. Okay, so once your serotonin goes very low, your depression goes very high, therefore your suicidal thought goes very high. Okay, by then, the doctor might decide, okay, take this medication. What medication does is that it chemically produces serotonin in your brain. So serotonin goes up, depression goes down, and the logic is suicidal thought goes down. Okay, but there are so many other natural ways to boost up your serotonin without taking medication, especially if you are experiencing low or moderate depression. Okay, one, smile. The more smile you do, the higher your serotonin goes up, your depression goes down, suicidal thought goes down. Number two, do anything that makes you happy. Okay, if you have your spouse, ask your spouse to tickle you, you laugh, your serotonin goes up, your depression goes down, your suicidal thought goes down. Or you just watch a comedy show or Maharaja Lawa on TV, you feel okay, you laugh, your serotonin goes up, your depression goes down, suicidal thought goes down. Or for me, I go jogging and I talk to myself, I do drawing, I do writing, I talk to my mom, I feel okay, my serotonin goes up, and then my depression goes down, suicidal thoughts goes down. That's pretty much what the approach is. Okay?
Yeah, I do remember also we have this cocktail of happy hormones.
Right.
And I always mention to my children that we need a dose of this. Then dose is DOSE, the dopamine, the oxytocin, the serotonin,
yes,
and the endorphin. So endorphin. So DOSE is where our body is able to produce it by stimulating them in various manners, as you shared just now. It could be exercise, it could be talking people, watching funny movies or incidences. So I think those are something that you could take that initial step before you want to reach out. But I suppose, Doc, some cases are temporary, they're not sustainable. And again, this thing have lapses or remission, or it comes back like a boomerang. So that's where you say seek help out, and then again something that could happen. And again, in many cases, is there a difference between men and women facing this kind of depression? So that then I know, by the way, I was told that there is higher cases of men commit suicide compared to women in the statistic. But Japan, when I read now during COVID time, women seems to be higher, 80% higher. And then there's a question by one of the participants where the postnatal depression is also common. So now gender, how do we handle this? You know, because we are also boys and girls at home.
All right. Okay. I'm going to go back to the questions. The difference between psychiatrists, psychologists, and psychotherapists.
Oh, okay, right.
Okay. Psychiatrists are medical doctors. They go through medical schools, so they are the only professional who can prescribe medication, meaning giving medications to treat depressions. Okay. Psychologists don't do that. Okay. Psychologists, psychotherapists can be psychologists and can be psychiatrists, because psychiatrists, not only that they prescribe medication, but of course they will also do some psychotherapy. Okay, because they also believe that medication alone will not take care of depression, because depressions are symptoms. Okay, that is very related to the issue of relapse. It is true. Okay, many people who are depressed go through psychotherapy and or medication. 6 months after that, they feel better, and then they relapse into depression. Okay. Because why? Because depressions are just symptoms of something bigger that trigger depression. Okay. So unless and until we resolve that main cause of depression, there's a possibility that depression comes back. Meaning, if divorce is the one causing depression, well, there's no amount of medication that you can take that can resolve that, because you need to resolve on the way you think about divorce. Okay, if relationship breakup is the cause of depression, then you still have to deal with that relationship breakup. Okay, that's why you require psychotherapy to handle that issue. Okay, that is very much related to support groups that we have not talked about today, because we so far have approached this subject from biological perspective and psychological perspective. We have not brought in social factors that lead to suicide and depression. Support group has proven to be one of the major thing that protects you from suicide. For example, if we look at data of marital status in terms of depression and suicide, okay, between single, divorced, and married people are the least likely to feel depression and suicide, meaning marriage is a protective factor against depression and suicide. Regardless of so many things that are going on in a marriage, at least you have that person next to you that you can talk to. Hopefully you can talk about your person, your partner, everything about life, basically. So one of the major factors to prevent relapsing is indeed having a social support, be family members or friends or colleagues that would understand you. Okay. On the issue of gender differences in relations to depression and suicide. Okay. Females are more likely to be depressed. Females are more likely to be anxious. If you look at the depression, anxiety, and stress scales, okay, females score higher in all three. Okay, but males are 3 to 5 times more likely to commit suicide. Okay, so where is the glitch there? Okay, yes.
So there is a disconnect now.
Okay,
because the ladies are more emotionally affected and yet they did not execute it. Men maybe not as emotionally, but they executed.
Okay, the theories say, number one, females have much stronger social supports than
yes, men. I agree that. Yeah.
Okay? Yes, they feel depressed more, stressed more, but they can pick up the phone and call their best friends and blah, blah, blah. For after 2 hours, they feel better. Okay?
Yeah, okay.
Males, they feel depressed too. They go to a bar and talk about business, because men are not supposed to talk about feelings and cry things. Okay, so the issue remains there. Okay, number two, males and females are very different in terms of methods that they use to kill themselves. Okay, males use much more lethal methods than females. Okay, in the Western world, the number one choice is gunshots.
Okay.
Okay. So if you take a gun, you put right here and you pull the trigger. Okay, once the bullet is released, even if you have changed your mind, there's nothing you can do about it. Okay, you go to the top of the building, 50th floor. Once you begin jumping, no, halfway, 25th floor, you say, oh, no, I changed my mind. You cannot change your mind because it's already falling down. Okay, women tend to take a shopping bag, plastic bag, and put around their head and pull it. And as they struggle, they change their mind, they open up, okay? Or they swallow 100 Panadols, most likely, they become unconscious, yes. Okay, their body will be taken to the hospital. The doctor will pump out the pills, and they feel better that way. By then, they may have changed their mind, or they take a knife and they cut their wrist. They may not kill you. You may lose blood. You become unconscious. Somebody finds your body and bring it to emergency room and revive you again, and you survive that way. So that's one of the reasons why male suicide rate is much higher than female suicide rate.
Yeah, I have a question, Dr. Adnan, about recovery. Based on your experience, how long does it take for a patient to recover? I know that it differs from person to person, but if you could give us some indications or case studies, because I think at the end of the day, we still need to see hope despite all the negativity surrounding the idea of someone close to us, a loved one, having depressive and suicidal thoughts.
Okay, I wish I have a magic formula there. Okay, based on my personal experience, therefore this is not scientific at all. Okay, it's just anecdotal evidence. Okay, if a suicidal person, okay, comes for psychotherapy, okay, about 1 to 2 hours every 2 weeks, okay, while following some regimen of medication if the symptoms are severe, okay, and with some support from significant others, usually it will take, inshallah, about 6 months to recover from it. Okay, so meaning there are many variables that involve in that whole treatment thing. Okay, because the flaw is maybe the client doesn't show up after 2 months, or the client stop taking medication after some times, or there is no support groups. That's why probably the clients fall out of psychotherapy and the medical intervention, because there's no support group to follow through. Okay, so there are a lot of moving pieces that would contribute to the recovery of a suicidal person.
Yeah, I also have a very good question. Coming back to the statistics that you shared with us just now, which showed that among teenagers, among youth, they are more vulnerable, because I suppose it's possible that that's a time, adolescence is a time when they're trying to make sense of life, meaning of life. So that makes them susceptible to depression as well as suicidal thoughts. So what would if you could share with us some valuable tips for those of us who have adolescents in the home or at school, that would be good.
Okay, it's true that if you're looking for statistics, I refer you to the National Health and Mobility Survey 2017, okay, the one that I referred before, when the government did a survey to all secondary school students in Malaysia, from 1 to form 5, basically. Yeah. Okay, so that's the survey that I referred to, and then they did depression, anxiety, and stress scales with all of them, and there are details there based on gender, based on batch, form 1, form 2, form 3, form 4, form 5, based on ethnicity and everything, and based on states, if you want to see where your states rank. Okay, and in all 3 scales, depression, anxiety, and stress, when you compare between batches, Form 1, Form 2, Form 3, Form 4, Form 5, for our friend from Thailand, Form 1 is 13 years old, Form 5 is 17 years old. The highest for depression, anxiety, and stress, and the highest in suicidal ideation, suicidal plan, and suicidal attempt is the cohort of Form 1.
Whoa.
Okay, and because this particular survey also asked those kids in terms of their sexual behaviors and their drugs use, their smoking and everything, and you find a similar data, unfortunately, with sexual issues, meaning our Form 1 is the most active sexually. Okay.
No.
The question is why that is. Why is that? Okay, if I were to theorize, okay, number one, the key word is transitions. Okay, well, life has to change because day by day, physiologically speaking, we grow older and older and older. Okay, transition has remained a very critical issue, meaning if you can go through transitions of life nicely, then your mental health will be okay. Example, now, if you are married and then your spouse passes away, then you become a divorcee. There's a transition in life there. When your status change from married being divorced. Okay, sometimes a positive transition too can cause stress, which you change from single to married. That's a transition too, okay, from now being single and becoming married. So what happens between primary school to secondary school then? Okay, number one, I think kids these days reach puberty at younger and younger age. That's one. Okay, so when you go through that transition, from being a girl or a boy to become a mature man and woman, okay, you need some intervention from parents there. What does it mean? Okay, in the similar survey that I quoted, they did ask these kids about their relationship with parents, and you will be horrified to see what they say about us as parents. When the kids were asked, okay, how many of you say yes or no, think that your parents checked your homework for the last 40 days? The answer was only, the one answer, yes, was only in 30%. When the kids were asked, okay, how many of you think that your parents know what you do with your free time? The kids that answered yes was only in 30%. And make it worse, when the kids were asked, how many of you suffered physical, verbal abuse at home? The percentage was 42% of them said that they were emotionally, verbally, and physically abused at home. I think that's where it is. I mean, that is the state of our society. Okay, that translates into the mental health of our kids. And what complicates issues is that they search for help online. Okay.
Doc, I know for some reason I didn't feel the 1.5 hour. You know, the time is like Zoom. It's Zoom as we Zoom in this Zoomina. So I'd like you in the next couple of minutes to give your conclusion and your final remarks as I remind the participant to complete the after presentation feedback so that then we can gauge and see whether there is a future need for a follow-up for that matter, and also probably address, Betty was asking about some quick skill development, and probably also enlighten us with your NGO for them to seek additional help, and your final thoughts and words on this subject then.
Okay. Depression and suicide are real issues. Okay, they're not imaginary issues. They are real. Okay, and we know the statistics. We don't have to repeat the statistics one more time. Okay, so in Malaysia, about 2 to 7 suicides happen per day, about 140 attempt suicide daily, according to the Ministry of Health. Okay, and the latest statistics released in Cosmo last week, okay, and quoted by Fakri in the introduction. The statistics shows that during COVID, from March 18 to the end of October, there are about 30 suicides per month, meaning one suicide every day. But I would like to caution us about that particular statistic because it came out from PDRM. It came out from the police department. It did not come from Ministry of Health. Okay.
Okay.
So it's a real issue. Okay. So number one, okay, learn the symptoms. Okay, the symptoms of depressions. Okay, number two, okay, listen to our kids if we are parents, as well as listen to our own body and emotions. Because as parents, we cannot give our kids 20 ringgit if we ourselves do not have 20 ringgit, meaning that if we are not emotionally strong, then we cannot give emotional support to our kids. Okay. Number three, do know that there is help out there.
Yep.
Okay. Okay. The government has its own excellent resources out there, and there are plenty of NGOs too. Okay, Befrienders had hotline. Our PKPM, the Persatuan Pertubuhan Kesejahteraan Psikoterapi Malaysia, we have talian reach you too. Okay.
What's the number?
I don't actually.
Oh,
I can
okay, never mind.
Later, and I'm pretty sure there are many other NGOs that offer similar professional, free of charge help. Okay. Next ones. Okay. Do know that you are not alone in all of this. Okay, do not feel that you are weak if you are reaching out. Actually, you are very strong if you reach out, because all human beings need somebody else to be happy. Okay, now if you drop the lessons of Islam, and Adam was very happy in heaven. Okay, he could eat whatever he liked. He can go to any happy places that he wanted to, but he felt alone. Okay, he needed another person. That's his support group. Okay, so be strong to reach out. When you reach out, it doesn't mean that you're weak in your life, because everybody needs to reach out. The strongest person on planet Earth also needs happiness through interactions with the other people. Okay, next one, especially for all teenagers. When you reach out online, please be extremely careful. Okay, it will be best, okay, if you first tell some adults around you about your issues before reaching out online, because there are good places to go online. Okay, but there are also not so good places, because in my mind, I felt that something could have gone differently for the case of Davia Emilia. Okay, mean that when she posted, should I live, should I die? Okay, I mean, I wish that the netizens would have come all out strong and say, no, you should live. These are the numbers that you should call. Call me, I can help you. Instead of they kept saying, okay, you should die, you should die, you should die. And then when the statistic became 69% for you to die, and then she committed suicide that way. Okay, that will be my last words here.
Okay. Thanks, everyone. And thank you, Dr. Adnan, for your invaluable insight. And I think a lot of us certainly has really gained lots of knowledge. I think from many of you, there's a 0 to 10. I think earlier was around 10, 0, 1, 2, but now it has certainly jumped to clearly 6, 7. And obviously, there is great opportunity to invite you in future for some more in-depth challenges and issues that we need to also equip ourselves, and case studies that we could look then. The responses from the participant has been very positive, overwhelmingly, for your certain expertise. We welcome that, and we certainly felt. You have your Facebook, or where can we connect you?
I truly want to disengage with any media.
Okay, all right, no problem.
So the best way to reach me is through my WhatsApp, Telegram. which I don't mind letting everybody know.
Okay.
019
019
386
386
5622.
Okay, that's your, I'm giving for the benefit of our colleague, Dr. Adnan, and I'm typing it there and people can quickly take a look then and hopefully, so inshallah, I hope that, I mean, we may not come out as an expert like Dr. Adnan, and that's not the intention. I think now is that with this little knowledge that we have, our job, and like the World Health Organization have asked, talk to someone at least for 40 seconds, because that is the that is the period where people commit suicide in the world at the very moment now.
One suicide every 40 seconds.
Yes, once in every 40 seconds. So with that, ladies and gentlemen, I hope that we can do our part and our role to our loved one, to our people who also may want to seek input from us. I think we play an important and pivotal role in helping out another human being. And more, this is not going to be the last nor the first. We hope that we can organize and invite Dr. Adnan again, with probably some other colleagues, so that it will certainly help us to provide a more good approach and techniques to help those people who are in need. Thank you very much again, Doctor. We wish you all the best. And for all of you, ladies and gentlemen, thank you for your time. And hopefully that we will reconnect again. Watch the space in Cool Mom Super Dad. Wabillahi taufiq wal hidayah. Wassalamu alaikum warahmatullahi wabarakatuh. I'm going to stop recording.